Action.
So this one is called right atrium, left atrium, right ventricle, left ventricle. Okay. Superior vena cava, inferior vena cava is here. Inferior vena cava, superior vena cava and inferior vena cava drain blood to the right atrium. This one is the opening of the superior vena cava, opening of the inferior vena cava, opening of this one is opening of the coronary sinus. Coronary sinus is here. This is the coronary sinus right here. This one opens right here. Coronary opening of the coronary sinus. So the brachiocephalic vein, okay, and this one on the right ventricle pumps blood. It goes to the pulmonary trunk. Pulmonary trunk bifurcates, divides into right pulmonary artery. This one is right pulmonary artery right here. This one branches right pulmonary artery, and this one is called left pulmonary artery. It goes to the right and left lungs, and blood get purified, get oxygen, and it turns from pulmonary vein. See, this is a pulmonary vein right here, and this is coming from the pulmonary vein. This is also pulmonary vein. From right and left pulmonary vein carries blood to the left atrium. So you can see the opening also right here. Two openings, okay? So they are called pulmonary vein. So pulmonary vein drain blood from the right and left lungs to the right atrium. So left atrium. And this is a ascending aorta. Ascending means going upward direction. And this one is called aortic arch. And this one going down is called descending aorta. Okay. Brachiocephalic artery, left coronary artery, left subclavian artery, ligamentum arteriosus, ligament connects aorta and pulmonary artery. Okay. This one I was talking about azygous vein. Okay, azygous vein. This is structure in the posterior side of the heart. This is a trachea, windpipe. We breathe in and out from the trachea, and the air goes to the lungs, right and left lungs. Okay, this is right. This is the right bronchus and left bronchus. Right bronchus and left bronchus. Okay, and behind the trachea we have esophagus, food pipe. So when you breathe in, the air will go through this trachea. When you swallow food, the food goes to the esophagus and goes to the stomach right here. Okay. So in the internal structure, you can see here. This one is called tricuspid valve, found in between upper chamber and lower chamber. Tricuspid valve is also called atrioventricular valve is there. That's why it's called tricuspid valve or atrioventricular valve. Atrioventricular in between the atrium and ventricle. Tricuspid valve found in between right atrium and left ventricle, right ventricle. Okay, and this structure right here. This one is called pulmonary valve or pulmonary semilunar valve, half moon shape semilunar valve. Okay, and when the right ventricle contracts, blood goes to the this valve opens up, and blood goes to the pulmonary trunk towards the right and left lungs. Okay, so this muscle is called trabeculae carne, and these valves are connected with this papillary muscle right here. See, these are called papillary muscle. Okay, They are called papillary muscles. And this cord-like structure is called chordae tendinae. Chordae tendinae, okay? Chordae tendinae. If you go to the left side, this is called bicuspid valve or mitral valve. Most of the time, the mitral valve prolapse, okay? Because pressure, high pressure chamber and low pressure chamber on the other side. And these are called papillary muscles right here. This one is called tricuspid valve, okay? And if they ask you what is the layer, inner layer of the muscle, layer of the heart, the endocardium, and myocardium is the middle layer right here, myocardium, and outer layer is called epicardium. And they're surrounded by the pericardial sac, filled with the pericardial fluid. Okay. So another structure you have to remember here. This one is called interventricular septum, right? And the space where these artery and veins are here, they are called interventricular sulcus. And this structure right here, this artery, okay, originates from the aorta right here. Originates from the aorta. So this one right here, this is called right coronary artery. Right coronary artery goes all the way down, and these are the marginal artery. Okay, right coronary artery and left coronary artery will be here. This one coming from the aorta, and this is the left coronary artery up to here. And when it goes down, this is called interventricular coronary artery. Okay, anterior interventricular coronary artery. And this one is called circumflex artery right here. Circumflex artery, okay? Goes all the way down. Circumflex artery. And this is the apex of the heart. This is the base of the heart, apex. And the another structure I can show you in this diagram. This structure right here, this is the superior sinoatrial node, atrioventricular node right here, okay? And after you can see this structure right here. This structure is called Purkinje's right bundle branch, left bundle branch, and they are the Purkinje's fiber. They are the Purkinje's fiber, okay? Purkinje's fiber. And other structure, opening of the coronary sinus, opening of the tricuspid valve, opening of the inferior vena cava right here, opening of the superior vena cava. Here. The greater vein, small vein, median vein. Okay, these are coronary sinus. Thank you. That's it.